Imagine this. Your baby won't stop crying. You're exhausted, frustrated, and in a moment of desperation, you shake them just to make it stop. But that one act could change everything forever. Welcome to our eye-opening guide on shaken baby syndrome, or abusive head trauma. Every year in the US, hundreds of kids under 5 suffer from this, and it's the leading cause of child abuse deaths in that age group. The scariest part? It's 100% preventable. Stick around because today, we're arming you with life-saving knowledge to protect the tiniest lives. Let's break it down. Shaken baby syndrome happens when a caregiver violently shakes a baby, causing their brain to slam against the skull. Babies' heads are huge compared to their bodies, and their necks are weak, like a bobblehead on a fragile stem. This leads to bleeding in the brain, torn vessels, and nerves. Most victims are under 1 year old, peaking between 3 and 8 months. Why does it happen? Usually, it's frustration from endless crying. Dads, stepdads, boyfriends, babysitters, even moms. Anyone can snap if overwhelmed. But here's the key. They often don't mean to cause permanent harm, but the damage is done. And let's do a quick myth bust. This is not from playful bouncing on your knee, tossing your baby in the air, or bumpy car rides. Those are safe and fun. Abusive head trauma requires violent, angry force, way beyond normal play. Now, the signs aren't always obvious. There are sometimes no bruises on the outside. Watch for extreme fussiness, lethargy, vomiting, seizures, poor eating, weird breathing, a bulging soft spot, or an inability to lift their head. If your baby's under 6 months and has any bruising, that's a red flag. Doctors look for the medical triad, bleeding in the eyes, which is present in up to 85% of cases, bleeding around the brain, and an altered mental state. An eye exam is crucial. The aftermath? Heartbreaking. 1 in 4 babies die. And for the survivors? Lifelong issues like blindness, developmental delays, cerebral palsy, hearing loss, seizures, learning struggles, and behavior problems. Even mild cases can show up later in school. Who's at risk? Babies with colic or reflux who cry a lot. Caregivers dealing with stress, depression, inexperience, or financial woes. Young moms, single parents, parents of twins, the list goes on. But knowledge is power. Let's answer a few common questions. How hard do you have to shake for this to happen? It has to be violent, like rage-fueled whipping. It's not accidental. It takes intentional force. If you suspect it's happened, call 911 immediately. Do not wait. Is the crying driving you crazy? It's normal. First, check the basics. Feed, change, swaddle, rock, sing, stroll, or use white noise. If nothing works, put the baby safely in their crib on their back, step away, and just breathe. Call for help. It's okay to need a break. A proven prevention method is the Period of Purple Crying Program, which slashed cases by 35% in Canada. Purple stands for Peak of Crying at 2 months, Unexpected, Resists Soothing, Pain-like face even when not in pain, Long-lasting, and happens more in the evening. It's a normal phase, it's not your fault. Prevention is the cure. Educate every single caregiver. Never shake a baby. Share calming tips. When you feel overwhelmed, remember these steps. 1. Place the baby safely in their crib. 2. Walk away. 3. Call a friend, family member, or a helpline for support. 4. Distract yourself. 5. Check on the baby every 5 to 10 minutes. If you're worried, get medical help. And always, tag team with someone else if you can. If you need support, you can call the National Parent Helpline or the Child Help National Child Abuse Hotline. If this does happen, a baby needs immediate hospital care, oxygen, medication, maybe surgery, and then long-term rehabilitation. Let's end this tragedy. Share this video with new parents, babysitters, grandparents, anyone who cares for a child. Comment below, what's your top tip for calming a crying baby? Hit like and subscribe for more life-saving tips. Together, we can protect our kids. Remember, a moment of calm can save a lifetime.